You are watching the DocTalk show.
Welcome back. We are discussing fibroids, a very common condition that affects women of reproductive age. That means women who in that time period are likely to conceive children, and it's characterized by abnormal growths within the muscular wall of the uterus or the woman's womb. With me in studio are doctors Dr. Mugisha and Dr. Masinguzi to help us understand more about these fibroids, how we can identify, how a woman can tell that she might be having fibroids and what can be done to solve it. So there's a concept that I don't know if it is entirely true, that women who don't deliver will get fibroids. Is that true, Dr. Mugisha?
Yes.
If you don't,
yes,
if a lady does not deliver children, if they don't get children, that they will get fibroids.
Yeah. There's been a protective factor that has been attributed to childbearing, to a woman who's had one or more pregnancies. We believe that the remodeling that occurs with the pregnancy, both during and after, is protective in a way. A number of women are found to either have them remit or have them really resolve completely after delivery. Those that were found to have fibroids during pregnancy or earlier, following pregnancy, subsequent sonographic scans show there are no fibroids anymore. So we believe it is in a way protective.
So the pregnancy, you're saying the pregnancy now is like a cure to the fibroids?
Not necessarily a cure, but I think let's stick to protective factor. Let's say it is a protective attribute to the lady that she has actually had a pregnancy.
Okay.
Yeah.
And why is that so? Why is pregnancy?
Yeah, again, those are speculations. You can't really say this is exactly, we haven't really found out that because of this, that's why this is not there. And the others also have the pregnancy, and these masses don't actually resolve, and they remain and give various complications in the pregnancy. So whether it is to do with the hormones that are a bit altered during pregnancy, because then the cycle is cut off, or the actual remodeling of the uterus as it is involuting after delivery. So those are still speculations, but we're seeing that women who have one or more pregnancies tend to have a more protective factor. And those who have them, sooner, as opposed to having a long inter-pregnancy interval. The child at 20, have another one at 35 or something like that. So those long durations are not as protective as someone who would have them more frequent pregnancies.
Oh, so if a lady, so what you're saying is delaying the process of having a child would predispose one to getting fibroids. If the gap between the pregnancies is too long,
that also predisposes.
In about how many years, you think?
There's nothing really pinpoint. Yeah, there's a lot at interplay, so we can't really give you specific duration.
But generally, a delay to getting children will predispose one to fibroids.
Yes.
I think that's mainly because of the surge in the hormones, like you had explained. The state of pregnancy causes an imbalance of these hormones, so probably that's why the fibroids resolve. Could that be?
That could explain. Again, those are theories that could be.
So you are watching the DocTalk show. We are discussing fibroids, which is a very common problem in women. We have learned that nearly 80% of women will experience fibroids in their lifetime, and these fibroids tend to occur within what they call the reproductive age. It means the time when the lady is most likely to conceive. That means they have very high surges of hormones, and they're at a high likelihood of developing these fibroids. Dr. Daisy, we understand fibroids are a very common, like you said, nearly 80% of women will experience a fibroid. How can women tell that they have a fibroid? Are there some signs and symptoms of this condition?
First of all, fibroids are mostly an incidental find. Most women might have them but not be aware that they actually have fibroids. However, in those who do have symptoms, they vary, okay? It can be from abdominal pain, so abdominal pelvic pain. It could be painful menses, heavy bleeding, subfertility, some women who have trouble getting pregnant.
Okay. So you're saying there's a varied spectrum of
yes, of
presentation.
symptoms.
So what percentage of women will have symptoms? What percentage won't? Do you have any idea?
About 4 out of 10 women will present with symptoms of when they have fibroids.
Okay. So that means the other 6 ladies won't know that they have.
Yes.
Won't know that they have fibroids. So it's a very quiet condition.
Especially at the beginning, yes, it is.
Okay. And when they start getting symptoms, Dr. Mugisha, which is the most common symptom that they'll present with?
So majority of presentations are bleeding abnormalities. That's about 30 to 40% of people with symptomatic fibroids are going to end up having bleeding abnormalities. Irregular, bleeding in between menses. Menses being heavier than they should actually be, others are prolonged, so
okay.
We usually have bleeding and they present with anemia symptoms, or they tend to lose a lot of blood over a prolonged period of time. These are women who will come so tired, so fatigued, chronically they feel a bit reluctant to do a lot of activities.
Okay, so that's because of too much bleeding.
Yeah.
So if if a lady experiences heavy periods, or the periods are becoming irregular, that is a sign that they may be fibroids.
Yeah, they need to have more, be screened more and see whether or not they can, fibroids can actually be.
So apart from bleeding problems, Dr. D, is any other conditions, any other signs a lady can tell that they have fibroids?
Yes, there are pressure symptoms. For example,
pressure. What do you mean by pressure symptoms?
As the fibroid grows, it causes compression on surrounding organs. Okay? So next to the uterus, there's the bladder at the front, and then there's the rectum at the back. Okay. So as the fibroid grows, it tends to cause compression of, for example, the bladder. So these women tend to have increased frequency of urination. They pass urine a lot. Okay? While posterior fibroids would tend to affect mostly the rectum, so they'd present with things like constipation. Okay.
Okay, so these are the pressure symptoms.
These are pressure symptoms.
And I think it happens when the fibroids are big.
Yes.
So when they're big, they compress the neighboring organs.
Yes.
So at the front, you said the urinary bladder.
Catheter.
The urinary
bladder. Yes.
So does it mean they also get many UTIs? Could that be a sign?
If of course you have small stasis meaning you're not passing out urine completely whenever you go to void. So urine stasis might also be a nice breeding environment for the bacteria. So yes, UTIs might be.
They can indicate.
Yeah,
that's mainly because of the big fibroids which have affected the structure of the process of urination. Okay, so I've looked at the pressure symptoms, I've looked at the heavy periods. Do they cause pain?
They are painful in two scenarios. One, if they probably have a stalk, sometimes these fibroids are just attached to the uterus by a stalk. And occasionally it might...
By what a stalk?
A conduit,
it's like a connection.
A connection to the uterus. So like we had alluded to, these masses can grow anywhere within the muscle of the uterus. Sometimes they are attached by some connection of sorts to the uterus. So occasionally this stalk might twist. And when it twists, this causes very, very sharp excruciating pain. And they come to the emergency units with a lot of pain, correction of which is surgical. The other pain scenario is if they tend to outgrow for their own good. They tend to outgrow their own blood supply. So in the long run, they sort of suffocate themselves on the supply of blood they have, and therefore subsequently become painful.
Okay. So pain is another very common symptom of these fibroids, on top of the bleeding and the pressure symptoms. You can always send your questions, your comments, your feedback to the social media platforms, and our doctors will ably respond to them to help you understand more about this very common condition called fibroids. Please stay tuned to the DocTalk show.
You are watching the DocTalk show.